Hey everybody, and welcome to part 4 of our ER workflow efficiency module of our bonus module here. And again, the goal here is to continue to improve our workflow in the ER so that we don't take notes back home. All right, so this module, it is going to be awareness of our socializing in the ER. All right. And this may be touchy. I know we want to be able to enjoy our work and enjoy what we're doing there. And that's why we're just going to get into what is extensive socializing in the ER and how can we best reposition that socializing for efficiency of our workflow. This is something I see all the time, and it is I see it frequently in people who take notes back home. And so this is just a way for us to rebudget how we use our ER time. All right, so we're going to have two parts here. The first one is going to be becoming cognizant of extensive socializing with colleagues and staff, and the second is extensive socializing with patients. All right, again, the whole goal of this course is to get us moving on time and getting our notes done faster. This is all for our own benefit. This is not for any time purposes, metric purposes. This is just for our well-being. All right, so part 1 here is extensive socializing with colleagues and staff. We do this all the time, and all I urge you is to just please be aware of this. I'm again not saying don't have fun at work, but remember that every conversation with someone or looking at photos of your colleague's recent safari trip to Africa has a cost to you during your shift. So be aware of your time budget in the ER and what you have to spend. And so just be aware that you don't have unlimited time in the ER. And that's just a fact. So every time you have in the ER is borrowed time from a future event, and it's borrowed time from your own productivity. That's just the nature of it. So spending your time budget looking at someone's photos when you can be finishing a note, it's sort of equivalent to going out to a fancy restaurant with friends when you're behind on your home rent. So again, just prioritize your ER time budget. It's very limited. We all know this. We all work in the ER, and we know how it feels to be crunched on time. Oftentimes I will, a lot of people will come up to me who are colleagues who may be coming off shift, or maybe not even working, and they'll want to share a story with you or show you one of their trips, and just be aware that those things take a lot of time, and it's not subtle sometimes. Again, something to consider is that socializing with consultants on the phone can take up to 5 to 10 minutes per call. I've noticed this all the time. They may be sitting in a different environment, and they may not be aware of the traffic that you have coming into the ER that you're managing. I think it's good to be cordial and to develop a good relationship up front, and if needed, make the time investment with your consultants. But please, as things continue, try to cut that time down. You can socialize with them after shift or at a later time, but you only have a very limited amount of time in the ER, and you don't know what surprises are waiting for you. So it just helps to be cognizant of those time frames. The next thing here, which I know can be touchy, is extensive socializing with patients. Again, this is just one of those things where we just want to be cognizant of the time we're spending with the patients and what we're actually there to do, and what is our role. So being very aware of what we're doing in that room is going to be important. And this is again the same idea as the prior slide. So just be aware to prioritize your ER time debt, and you don't have unlimited time. And I wish we all did, and I wish we could all sit down with each patient, take the time to get to know them, where they're from, what they like and what they enjoy, and it may make our care better. But just something to continue to keep in mind, that every bit of time with one patient is borrowed time from a future patient. And that's just something that's very real. It's very true to our experience as ER providers. So again, if you are talking to a patient about maybe their wartime or something that has been going on in their lives, just being aware that that is time away from your next posterior nosebleed that may come in, or your next cardiac arrest that may come in. And these things are going to delay your ER workflow time. Again, This is not for metrics or anything besides our own well-being and just being able to get out of our ER shift on time and have our notes done. All right. Thank you guys, and we'll continue on here with our next part.